Welcome to Fempower Health. This is Georgie. I'm going to change it up a bit today, and rather than interviewing one of the amazing experts I get to speak to on this podcast, I'm going to share my journey through perimenopause and menopause and weave in some of the learnings from these amazing experts. First, let's start with terminology. It is really important to know the difference between perimenopause and menopause, because as Dr. Jerry Lynn Pryor shared in my most recent interview with her, it matters because the symptoms differ and so do the treatments. And so it's really, really important to have awareness of the stage that you're in and be able to communicate that to your provider so you can have a more effective conversation. Okay, so menopause is defined as 12 months without a menstrual cycle. Some have said menopause is the day that happens and then postmenopause is after that. Some have been using postmenopause and menopause interchangeably. What's more important to know, though, is the difference in that before that time, it's perimenopause. And perimenopause can last for a varying degree of time depending on the woman. And so this is where talking to your family members is really important, because the way that your elders, so to speak, like your mother, your grandmother, etc., experienced this stage of life will be a good indicator of what you may be experiencing as well. And so for the early signs, you really just have to notice these changes in your body, and everyone's going to experience it differently. So you may have breast tenderness, your mental health will change. You may have the hot flashes, changes in your menstrual cycle. So all of these different things, you just have to notice the change and kind of keep it in the back of your mind, or better yet, write it down and just start noticing it. And perhaps even noticing triggers, because it may be even things that you're eating, drinking, the way you're sleeping, the way you're working out, that can also have an impact. And not to say if you stop those, it will all go away, but it's also important to be able to identify the triggers, because that will also help you have a better conversation with your doctor. One of the things that's really interesting to me about this stage of life is, I've been thinking about my journey, is our bodies, they're complex. We have these fabulous hormones, and different things that happen to our bodies really do have an impact on them. So if you think about it, if you have PCOS or thyroid disease or endometriosis, that's going to have an impact. If you've had children, how many you've had, if you nursed them, if you've had a hysterectomy, of course, perimenopause and menopause, all of these are changes in our hormones that have an impact on our body. And so many people say that with perimenopause, it's really about symptom management and understanding what these symptoms are rather than necessarily doing blood work. And that's really, again, how your clinician can help you. So back to my story and why I brought in the complexity of our bodies is I started fertility treatments, I think my mid to late 30s, and it took 4 years. So I was injecting myself with hormones. I had obviously gone off birth control, and it was quite stressful. There's a lot of complex things going on in my life. So who knows, maybe I hit perimenopause then, maybe it was the fertility treatments. I had a perfect 26-day cycle after I went off hormonal birth control. And once I had my son, I did try for a second. So I was clearly monitoring everything about my body, because I was trained to do so for 4 years prior to that. And I noticed that my cycles did start to shift. I would have a long cycle, then a short cycle, and that would go back and forth for like 6 months. And then the longer cycles became longer, the shorter cycles became shorter, and then it just became a hot mess. I don't know what was happening. And then I think it was, so I did start to truly monitor, because in 2020, in the midst of COVID, I had the fortune of interviewing Dr. Lara Bryden for a second time, because she had just published her book, Hormone Repair Manual. And I don't think at the time I knew what perimenopause was, and reading her book and then interviewing her really helped give me some clarity. And, I was really stressed out with COVID, not with COVID, but during COVID. And I was having all these like mental health issues, which I attributed to COVID. And I'm sure it was actually COVID plus perimenopause in one big swirl. And for those who are in perimenopause and dealing with the mental health issues, you can just imagine what that must have been like to add COVID on top of it. Or I should say the pandemic and living through that pandemic. And, it was certainly a struggle. And I think then it was still the early stages of discussing hormone therapy. I don't even know if people were talking about it that much because, again, it was only in the past couple of years, I would say, that people have really been talking about hormone therapy and menopause more frequently and in greater detail in social media and other outlets. But nonetheless, Dr. Bryden's book was so incredible. And I really just started monitoring my symptoms. I knew to monitor my menstrual cycle. And I had already had a mental health condition, so we were more just monitoring that rather than trying to add hormone therapy. So then fast forward, I think now I'm 2 years into menopause, and it was Thanksgiving 2 years ago, so almost 2 years. And I was monitoring my cycle because I had learned from Dr. Bryden how important it is to do so, and I highly recommend all of you do that, because if you do have bleeding after you've hit menopause, so after those 12 months, you could be at risk of endometrial cancer, meaning you need to figure out why you're bleeding. And so if you know that it's been over 12 months, you definitely want to go to your doctor to be able to get checked out for that, because that actually happened to me. So I had hit 12 months with no menstrual cycle, and then I was on a trip to Arizona, and as soon as I got back, I started to get a menstrual cycle again. So this is now 6 months after I thought I had hit menopause. And so I had another cycle after that, and I have heard of many people who do get their menstrual cycle back. I mean, it varies so much for women. So again, I'm not even going to try to make sense of this and tell you this is what happens for everyone, because generally the rule of thumb is 12 months to a menstrual cycle, you have menopause. Some do have breakthrough. Summary is, if you have breakthrough, so to speak, please go visit your doctor. So I did, and she tested me for endometrial cancer. So I had to get the little biopsy and await the results. And it turned out when I went to see her, I also had an ovarian cyst, and she said it wasn't big enough to have to take out right away and to wait and see. So we waited for the test results of the biopsy, which turned out to be negative, thankfully. And it turned out the cyst ended up going away. So then I was fine. So then time passes. I think I'm fine. I'm still really off mentally, but I attribute it to my mental health condition, stress. I'd already hit menopause, and everyone talks about the brain fog and perimenopause. So, I just kind of lived my life. Didn't think I needed hormone therapy because it seemed like all of the discussions on hormone therapy had to do with hot flashes, right? And I had them here and there, but it would be more like if I had a glass of red wine, I'd get a hot flash, and then that was it. So I didn't think much of it. Then I did an interview with Dr. Ali Sharma on menopause and mental health. And she is, by the way, a mental health professional, not a hormone therapy expert. And she made that very clear in the episode, but I do highly encourage you to listen to it. By the way, I'm not having my editor edit this. So if you see me making a couple of mistakes, I'm being raw here. I'm being real. So forgive me. But nonetheless, that episode changed me, because just the way she was talking about mental health, I had this aha moment, and I thought, hold on a second. I wonder if I need hormone therapy, because my psychiatrist and I have been working on this. I had these like ADHD like symptoms, and we tried everything. We could not get them to go away. And things would work, and then they wouldn't work. And I was like, I'm still off. Something's just off. And I mean, there were days I was really, really struggling and just trying to hang on. So nonetheless, I listened to this episode and I thought, wait a minute, do I need hormone therapy? So I called my OBGYN, and I was very grateful to have a telehealth visit, because I was really stressed out. Everything felt hard. And I was worried that I was going to have to like hike over to her office, sit in a waiting room, get the appointment, hike back home. Oh no, it was a quick telehealth visit. And I shared with her, what I learned on the podcast. I shared with her some of the data that I've seen. I've shared with her the things that I've tried. And we agreed that I should try the estrogen patch. And because I still have a uterus, she obviously prescribed progesterone. And within a few days, I felt like a different person. And by the way, anything that I share on this episode is not medical advice, and it is not to say this is what you should be doing, because as you can see, I have a long medical history here, and the medical history is what matters in driving the decisions that you and your provider make. So it's really all about shared decision making. And before I forget, I also want to say, many have asked, who do you trust on social media? How do you know if what people are telling you is correct? I would say this: leverage the information that you're hearing and use that as data points for you to think about what might be happening with you. Monitor your symptoms, monitor changes, list out concerns that you have, and then talk to your doctor about it. And have a bulleted list. Don't show up with at your doctor's office with like a 15-minute vent session, because they're not going to be able to help you. These are short appointments. It's a really rough healthcare system. And just share the data, just like I did with her. Is my understanding is, hormone therapy could possibly help with these mental health conditions. I have tried this, this, and this with my healthcare provider. The hot flashes and things like that aren't that big of a deal, but I wonder if we could give this a try. That was pretty much my conversation. So we still went into a lot of depth, but it was just the bullets that we needed to cover, and I was able to get what I needed. So then I still wasn't sleeping that great. And I don't remember the order of events. It doesn't really matter at this point. Long story short, I had a discussion with Dr. Jerry Lynn Pryor, and she was saying that according to some of the research she's done, 300 milligrams is actually the proper therapeutic dose for progesterone. And it really helps with sleep. And she actually felt that the progesterone would be way more helpful for me than the estrogen patch, especially because I didn't really have a lot of the hot flashes. So I ended up had my upcoming appointment with a doctor, because she wanted me to sit on the original dosages of the hormones for a few months before we made any changes. So I ended up having my annual exam with her recently, and we had a whole discussion about it. And she says, I hear you on the increased dose, and I agree with you. Let's try it, but let's not go from 100 to 300. Let's try 200, because we don't want you to zonk out by taking progesterone and not being able to function at all. So let's slowly titrate it up. So now I'm on 200 milligrams. The other thing I've tried is melatonin. Melatonin is something I tried when in the midst of the pandemic, and it never did anything for me. But for whatever reason, now I have noticed that it's helped with my sleep. I also try to make sure I have a nice wind down bedtime routine. I wear blue light glasses after 7 o'clock. I really try to stay off screens. So it's not just the hormone therapy and some of these, the mental health medications that I'm on, but it's all of these different things that I've had to do to really make sure that I feel good and don't have all the symptoms. I also monitor my diet. After 4 years of fertility treatments, and you try anything and everything to have your kid, I certainly learned a lot about what my body needs from a food perspective. And so I don't eat dairy, no gluten, except now I'm able to do sourdough bread, which is fabulous. I've also been able to add butter back into my diet, but if I try anything else, heck no, I get so sick. I also, exercise regularly. I notice that if I go more than 2 days, I get really stressed out. So I try to do that. What other things? I would say those are the main things that I've been doing. And I now just monitor the symptoms, and I feel great. I will say the one thing I did notice too is carbs. And I am so not about to go on this discussion on no one should eat carbs or carbs are amazing. This is, again, not medical advice. I'm just telling you what I noticed. For me, I noticed that if I eat a lot of carbs, I just feel kind of heavy. And so I found what worked for me is eating lighter. Like I could eat protein in the morning. And I know that in Lara Bryden's recent book on metabolic health for women, I just did an interview with her. She talks a lot about how we women don't eat enough protein. And so I definitely work on getting my protein in the morning. And if I do carbs, I find I feel less icky if I do it at night. But if I eat too many, then I feel icky no matter what. However, now I'm training for a marathon. Oh my gosh. I am carbo loading like nobody's business. So yay carbs. But again, that's just me. And again, I've had the honor of interviewing so many experts on nutrition and health as well. And so I take all their advice to try to figure out what's going to work for me. Okay. So I think I covered it all. I think I covered how it's complex. You have to monitor your symptoms. Some of the experts I speak to say don't even bother with even the at-home hormone tests that you can purchase because it's really all about symptom management. So however it is that's going to work for you to track what's going on, please track it. It doesn't have to be this laundry list. Just know your menstrual cycle, how it's changing, how you're feeling, what triggers a symptom, what makes it get better, what makes it get worse, what possibly makes it go away. If you just kind of keep track of this stuff and have a little note thing on your phone and just jot down these things, that's way better than just showing up at your doctor's office incredibly frustrated and the doctor not knowing where to begin. The more specific and the more clear you are, the more they are there to help you, or the more effectively they can help you. The other thing is, I know there's been a lot of discussion on social media about frustration with doctors. I think it's important to know that once the Women's Health Initiative study was published about 20 years ago, because of the way those results were analyzed, it's been really challenging to find clinicians trained on menopause, because once that data came out, they pretty much just didn't really teach it the way that they used to, if at all, in medical school. And recent reports showed that way less than 50% of med schools are even training on perimenopause and menopause. So if you understand this, then you will understand that it's really important to not just rely on any OBGYN to help you with something very, very specific. It's important to find a clinician who has been trained on this. One thing I will say, you may ask, what about the coaches? I don't know the type of training that the menopause coaches go through, so I will not speak for that. If they're not, you know what, I'm not even going down this road because I am not an expert and I am analytical. I would want to read about their training and then I can give you a proper assessment. I would just say my presumption is that they've come to life because of the challenges with the healthcare system and the 10-minute appointments with our doctors. If you do want to find a menopause trained expert, one of the places you can go is the Menopause Society's website. I will say I have heard some challenges in the sense that you will know the doctor and you will know their location, but you will not be able to gather from that site is whether or not they take insurance. So I had a friend share with me that she looked at maybe 10 websites or 15 websites and everyone was cash pay. And so she couldn't find anyone who took insurance. And honestly, this is not a surprise because with our healthcare system and the long appointments that are required to properly help someone in this stage of life, I'm not surprised that that is the case. However, please don't lose hope because there are clinicians who are in network. And I think the clearer that you are about what's happening with you and the more succinct you are, I think you can, or I should hope that you can get the help you need or at least guidance on where to go next. But so anyways, it's I hope that helps. Okay. So a couple of episodes that I would like for you to consider listening to that I think are very helpful and unique. So I've already talked about Lara Bryden's episode on metabolic syndrome And I think a lot of that information can be useful for women in this stage of life, or really all women. Dr. Pryor, again, talking about perimenopause and menopause. And she also talks about progesterone versus estrogen. Progesterone is one of those hormones where it's like estrogen took over and everyone talked about estrogen. And finally, over the past few years, we've been hearing more and more people talking about progesterone. But I call that episode out because when it was first published, and then every time I republish it, it performs extremely well. So I'll just tell you about it too, because everyone wants to talk about it. I spoke about Dr. Ali Sharma's episode with me on mental health in this stage of life. Definitely a great one. There are several episodes on sexual health that I think are really important. I know the Sober Curious movement is hot. Thank you to Ruby Warrington and others. I interviewed Ruby on Women Without Children, but she also wrote the book Sober Curious. I did interview another expert on this, so if you'd like to listen to that, feel free. And then another is genitourinary syndrome of menopause. I know some are frustrated by this terminology, and I think the intent is to try to say, hey, there are these things that happen to you during menopause that affect like your urinary tract, etc. So this is the term that has been provided to try to give some indication of the area in which you may be aware of for this stage of life. And so Dr. Maria Uloko talks all about that. And one of the things discussed in there, of course, is vaginal estrogen. Oh, see, I forgot about the vaginal estrogen. My goodness. Okay. So after listening to or doing this interview with Dr. Uloko and attending an event by Let's Talk Menopause, I learned about the importance of vaginal estrogen. So I had gone to an OBGYN. It was the one that was before the one I currently have because she had retired. But before she had retired, she was my doctor, and I got the vaginal estrogen. But I was given the tablet, and I still noticed dryness and pain with sex. And so I don't remember how I had realized that the cream is also an alternative. And so I contacted my doctor, and I was like, I think I might need to switch to the cream. And the cream goes more on the outside, like not all the way up into your vagina, but more in the vulva area and the opening into the vagina. And so I switched to the vaginal cream, and I love it. I thought it has worked fabulously. So highly recommend, but again, talk to your doctor to ask about it. And I know many people have questions about the safety of hormones. There's a lot of different episodes I've done on that as well, and will be doing in the near future. I'm actually interviewing Dr. Michelle Jacobson, who I saw speak at ACOG, and she really works a lot with women who are trying to sort out hormone therapy, but have had cancer or at risk of it. And so they really want to talk to her. And so I'm really excited to interview her to learn more about how women can have shared decision making on this topic. Dr. Stryker, she is going to be talking to us about the top 10 questions that you have on this stage of life, and she will answer them. And I love what she does in that episode. It's short answer and then the long answer. Love Dr. Stryker and her detail-orientedness and desire to speak from a data-driven perspective. Also, Guy Daniels. He was the second person I ever interviewed on the Fempower Health podcast, and he is now known as the gut microbiome, or actually, he calls himself, the microbiome expert. And he is going to talk to us about the microbiome. And I said, Guy, I'm really intrigued on how we're going to leverage this for menopause. So stay tuned. I'm really excited to do that interview. And then, of course, Kelly Casperson. We are going to talk about sexual health and perimenopause and menopause. And I won't lie, part of this was influenced by my fear that sex life is over once you hit this stage of life. Because you hear all these people sharing these stories on social media, and then, I'm talking to these experts about all these things that can happen to your body if you're not proactive, et cetera. And so I won't lie, I was pretty darn scared. And so when I knew that I was going to be interviewing Dr. Kelly Casperson, I thought, this is what we're going to talk about. So I'm really excited for that interview as well. So I may have missed a few things. Apologies if I did. I hope that this was helpful and enjoyable. Sometimes it's nice to just know you're not alone and to have someone else's perspective. it can be a scary time in life, but, the great news is so many people are looking at this stage of life and talking about it. And we're now getting the awareness that we need. I do want to say, for those who are in perimenopause, I know that some may fear and want to deny this stage of life because it means we're getting older and we don't want to admit that these things are happening. I'll just say this and take it with a grain of salt. One, so I'm 50, and I will say it is fabulous. So just, you get to look forward to some good things ahead, I promise. And, you deserve to live a great life. And so please don't struggle with brain fog. Don't, just don't suffer. There's a lot of things that you can do and that your doctors can do for you to help you. And just make sure you get the help that you need. And it's okay to say that you're in perimenopause. It's a factual stage of life. It's not a judgment. There's nothing wrong with you. It's a stage of life. And there's things that you can do to feel better. And so I do hope that you will get the help that you need because you deserve it. I certainly remember my night terrors during perimenopause, and I am so glad that they're over. So I think that's it. I feel like I might be babbling now, so I'm going to just stop talking. And I really do hope you found this helpful. If you have suggestions for other topics that you want me to personally discuss, I am more than happy to entertain that idea. I have to say, I'm much more comfortable interviewing the experts, but some have said I have interesting stories to tell. So I'll let you be the judge. Let me know what you think of this and anything else you may want me to cover. And I'm really, really excited to share these upcoming episodes with you. And I hope you listen to some of the other ones that may prove helpful to you as well. Thank you so much for your support of Fempower Health. Have a wonderful day. And that wraps up another insightful session here on the Perimenopause and Menopause channel of the Fempower Health podcast. Before you go, I've got 2 quick, exciting invitations for you. First, join our vibrant community by subscribing to our newsletter. And it's not just any newsletter. It's your frontline update on groundbreaking women's health research, the latest health-enhancing products, and unique discoveries you won't want to miss. All of this delivered straight to your inbox, cutting through the noise of social media algorithms. Better yet, you can pick the Perimenopause and Menopause edition or the Chronic Pelvic Pain edition, or both. Second, if you enjoy our perimenopause and menopause content, don't forget that we also have a main Fempower Health podcast feed that covers a wider range of women's health topics. Additionally, if you're interested in chronic pelvic pain, you can subscribe to that specific feed too. Find these channels on our website or wherever you listen to podcasts. And if you love today's insights, show your support by rating and reviewing our podcast. Your feedback is more than just a pat on our backs. It lights the way for others seeking guidance and community in their health journey, amplifying the voices that need to be heard. And for a deep dive into today's topics, check out the show notes and explore our website at fempower-health.com. Our site is a treasure trove of knowledge neatly categorized by topics of interest, ensuring you find exactly what you need to empower your health journey. And your voice matters to us deeply. Whether you have a question, a story to share, or feedback on our episodes, reach out directly at info@fempower-health.com. Drop us a message on social media or hit reply on any newsletter. Your insights inspire our conversations. And don't forget to follow us on social media for more updates, tips, and community interactions. We're on Facebook, Instagram, and TikTok at fempowerhealth.perry.meno. Quick note, the knowledge we share here is to embolden you in discussions with your healthcare provider. It's not medical advice. Always consult with your doctor for health decisions. And remember, the diverse perspectives of our guests reflect their individual journeys, and it's not an endorsement by Fempower Health. And here's to empowering your health journey, one episode at a time. See you on the next Perimenopause and Menopause episode of the Fempower Health podcast.